Good morning. I'm back now with Dr. Michael Rowe from the Rockford Spine Center. How are you?
Good. How are you?
I'm fantastic. Now, I'm so happy you're here. We have a lot to say about the Rockford Spine Center. Not only is it ranked #1 in many award books, but in Rockford especially. This year alone, it's been in Newsweek for the 2012 nation's leading spine surgeons. Becker's Spine Review 2012 top 50 spine surgery practices to know. I mean, the list goes on, and we're just here in Rockford alone. What does it mean to you to be a part of a group that is world-renowned and around the nation, and we're not in a major city here in Rockford?
It's a great feeling. It's quite an honor to have brought these services and this level of services to a town like Rockford, which 10 years ago really needed it. And when we got here, a lot of people had to leave Rockford for spinal surgery. It's a big deal, and it's not something you want to take a chance on. But since being here, I'm very happy to say that I and my partners, Dr. Sweet, Dr. Sleva, we now provide pretty much anything that is needed for the spine, and I would say that we do a good job of it. At least that's what we're told with all these awards and recognitions.
I know it's got to be flattering. You know, you said you came from New York City, sort of didn't know what to expect when you came to Rockford. But what now, and you've been here for close to 10 years, and that's sort of when the Spine Center came about. Can you tell me what brought it up, and how did RMH decide to bring this into what it is now?
Well, let's see, 10 years ago, Fred Sweet, who was one of my partners, and we decided that we had this common vision that we wanted to create a place where, kind of a one-stop shop, one place where people could come and just find out what's wrong, have it explained, what options they have, and then get treated there. So that's why it's taken quite some time, but now we have everything on site. We have the doctors, we have physical therapy, we have MRI, we have X-ray, we have pain management, we have nerve testing. I mean, we have everything that would be necessary in order to diagnose and be able to treat and take care of patients with these complicated problems. So, like I said, it's been a work in progress, but now, I mean, everything's really humming along. We have a large group of very happy, satisfied patients there, and I think that's who is really bringing a lot of the recognition to the Spine Center, because, for instance, this Patient's Choice Award, from what I'm told, that's only given to 5% of physicians in the United States, and that's entirely based on satisfaction and patient input and patient recognition. So that particularly has been very humbling.
And now, coming to Rockford, a lot of, like you said, a lot of people think that they have to go to Chicago or they have to go to a bigger city to get serious surgeries like this done, your spine, you know, a lot of times your neck. But, you know, you say here in Rockford, the Spine Center offers just as great of services as the bigger city hospitals, right?
Yeah, if not better. It's kind of an unusual situation. As you can imagine, doctors are trained and they come from here and there, but I'm very privileged to say that all of us at the Spine Center have been trained at only the top places, and we've been trained to the very highest level that a spine surgeon can reach. And so for all of us to be here in Rockford is unusual, and it's not something that maybe everyone would know or really even need to know, but what matters is the care is good, and our patients do very well, and I think that's been shown most recently.
And now you said you studied at Columbia, you did your residency, at Columbia, studied at Brown, and coming out to the Midwest, I'm sure was a shock, but has it proved to be a great decision in not only your practice as a spine specialist, but also in order to help people in a local community like you do here?
Oh, absolutely. Coming from New York City, I can say without a doubt, people here are much nicer.
I can agree with that. I've been to New York City.
Yes, nothing against New Yorkers, but and they're very grateful, very gracious, hardworking, grateful people who all they know is that they're in pain, they're scared, and they need to find trust. And so when we started the Spine Center, we really built it on a quality-based model where the patient comes first, we address all of their needs, and that we treat them to the best of our ability. And if it does require surgery, which is what we do, then it only be offered in the event that the patient really has an excellent chance of doing well. And so it has taken time for us to build our reputation, because if you are going to be selective and if you're only going to offer surgery to people who are going to do great, then, well, you're not going to operate on everybody, and some people you're going to have to turn away. But in the end, the people who have done well, they apparently sing our praises. And it's most recently that our partnership with Rockford Memorial, I mean, we operate at all of the hospitals, St. Anthony's, Swedish, but Rockford Memorial recently received some really prestigious awards in the area of spine surgery as a reflection of our partnership and working there.
How wonderful. Yeah. But after the break, we're going to talk about, you know, what the Spine Center has to offer, and the patients, what often patients feel when they come in and want your help. We'll have more after the break.